Okay, so we're going to be talking about the roles associated with the concussion team at various facilities. So one of the main things we want to drive home is that every institution, whether it be a high school, whether it be a middle school, whether it be a club sport, we want to have a plan and a protocol in place. The main reason for the plan and protocol to be in place is so that everyone knows their role, they know what the expectations are, and for ease of communication is the main reason that we want to have a protocol in place. So with this, we want to include everyone that's going to be caring for this patient. We want to make sure everyone's on the same page, and we want to make sure no one's missed or left behind. Okay, so one of the first members of the team is the first observer. This can be a coach, it can be a teacher, oftentimes it's a friend or a teammate. It can be anyone involved with your organization. The role of the first observer is to initiate the concussion plan and protocols. What they are looking for is something's not right. This individual doesn't seem normal. They're not responding to situations that we've seen them respond to normally in class, with sports, with friends. Something just seems off. So the first observer is usually the initial contact if the individual is reporting concussion symptoms, or they're the person that may directly observe the incident, or they observe the abnormal behavior. So the role of the first observer is to inform the correct people associated with the protocol. So your institution's protocol may have a reporting for this goes to the athletic trainer, this goes to the school nurse, this goes to the counselor, this goes to the coach. And then we initiate plans to loop in the parents and getting this individual the care that they need. If there's no observer, this is when someone gets injured, there's a potential head injury, and no one witnessed it. This is the person individually reporting, saying, hey, something's wrong with me. And when they come to you in class or in the hallway, and they just don't look right, and you say, hey, how are you doing? Is everything okay today? And they're like, I feel dizzy. I don't feel right. I feel confused. I feel foggy, groggy. Then you ask a follow-up question. Well, what happened? What caused these symptoms to occur? And when they report to you, you're looking for signs and symptoms associated with concussion. And then you want to report that to the next level in your protocol. All right, members of the athletic team, this is going to be your coaching staff, your athletic directors, your team managers, and your game officials. It'll also include your athletic trainers, and will include any other sideline services that are provided. The coaching staff is a valuable member of the healthcare team. They are the ones that really know the athlete. They're the ones that can pick up on subtle differences. They're the ones that have had conversations of, hey, how's everything going at home? They know their personal life. They know the triggers that can give them symptoms that could be confusing with concussion. So a lot of times the coaches are the ones that initially tell you, hey, something's wrong with this kid. They need follow-up services. For the coaching staff, they need to be well-trained in concussion identification and management. They need to know their protocols. They need to know who to report to. So our coaching staff should be well-trained. And so I'm assuming there are coaches here or online. So this is part of the training. But time should be set aside for them to understand, specifically set aside for concussion and the protocols associated with your institution. The main role of the coach is to recognize something's wrong, something's not right, and refer that patient for a healthcare assessment. In a lot of our high schools, that may be directly to an athletic trainer. During the school day, that may be to a counselor or a nurse, assuming your school has a counselor or a nurse. Or it could be reaching out to parents to initiate treatment with very specific instructions. This is what I need from you. This is what I saw. This is what your kid told me. They need to communicate the situation. So communication can be in conjunction with the athletic trainer. A lot of times we will see a patient. We have not made a concussion assessment yet, but we may give the coach a heads up of like, hey, go ahead and call the kid's parents, get them coming this way. You don't need to give them tons of details. Just say, hey, your kid was injured today. We'd like for you to come up so that we can get you access to your kid and be part of the assessment process. Additional communication will be to pertinent school officials. So depending on your protocol, this may be to your counselor. Depending on the time of day, this may be directly to your school nurse. It may be to both. The principal or the administrator in the building will probably need to be notified of the situation and what's going on with this kid. And then also we'll need to let the athletic director know what's going on. And the purpose of this is to let everyone know something's going on with this kid. We need to adjust our expectations. We need to wait for more information to emerge. A coach may be the person that implements the return to play protocol. And so in Missouri, that will be the MISHA return to play protocol. This will be done under the direction of a licensed healthcare provider, but the progression through the return to play in some circumstances and based off your already written plan and protocol may be administered by the coach. The coach cannot actually release the individual for return to play. That will be communicated and done in conjunction with the licensed healthcare provider. But the coach many times is very involved with that progression. If the return individual is doing activity and they start getting symptoms associated with that activity, the coach needs to be aware, hey, we're going to stop today. We're going to talk to our healthcare team about what we should do about this. Another important thing is that coaches need to be good role models. They need to educate their players. They need to have honest conversation with parents. They need to be available to receive information, to recognize information, to do what's right for the kid. And a sad thing we kind of have to acknowledge is when a kid for the opposing team returns to play after concussion, hey, we're not going to target them. We're not going to try to put them out. So the coach needs to be a very good role model about head injuries and taking them very seriously. Also needs to really encourage and promote that their players don't withhold symptoms. So we know from the research, if we honestly survey athletes after a season, we have a large number that will say, I think I had a concussion and I didn't tell anyone. And so the coaches are part of the solution of this is a big deal. We need to take this seriously. Please inform someone so that we can work you up and make an appropriate decision for you. The final thing to consider is that the return to play follows return to learn. So we have to get the kid back in school. We have to get them functioning fully before we can even think about starting up their physical recovery. Okay, the athletic director. Based off the schools that I've been at, this has almost always been one of my biggest allies. This is the person that when things are busy, when I'm managing a concussion case, my athletic director is my point of contact. They're the person that I'm going to probably call first and say, hey, this kid's got this going on. This is the next thing I'm doing. I'm reaching out to the parents. I'm doing this. And the athletic director is the one that initiates the chain of communication. Based off your protocol, that may be your athletic director. I'm discussing my experience here. That also may be your counselor, maybe your nurse. But for me, the athletic director is the person that knows the protocols the best. They know what the kid and the parents probably need. And so they have a defined role in the protocol of when my athletic trainer or my nurse calls me and says, hey, this kid has a concussion. These are the people I need to reach out to. These are the people I need to loop in. So for me, that's the person that's always informed the principal or initiate the conversation with the counselor, especially if this is done after hours, so in the evening, so that the counselors are prepared for the plans the next day. They also will work with the counselors to notify teachers. of this kid suffering an injury. We don't have all the details yet. They may or may not be here tomorrow. If they are here, they may need accommodations. We may need to have permission for them to leave the classroom, go visit the nurse, go visit the counselor, go visit the athletic trainer. They may be late to class. They may not be in class. Please be patient regarding this one kid. Please loop me in if you notice anything during the class where you just think the kid needs extra attention or should be somewhere else. The athletic director is also responsible for ensuring that the coaches are trained. They should set aside time throughout the year of this is when our coaches are going to meet. We're going to review our protocol. We're going to talk about signs and symptoms of concussion, and we're going to talk about our management plan. They should also provide educational opportunities through team meetings to parents, to the athletes themselves. And on the training for coaches, the important part I left out is making sure that there's time and money for the coaches to seek appropriate training. So that's a very important role of the athletic director. Okay, the athletics team manager. Manager can kind of mean different things based off the setting. It can be kind of an administrative oversight role in certain organizations. It can also be someone who assists the coaches and the team. The athletics team manager needs to know the protocol. They need to be aware of the signs and symptoms, and they need to know who to report to. The main job of the team manager is to kick things off, recognize what's going on, get this person to the next individual per the protocol. Okay, people we sometimes take for granted and we forget about as being important members of a concussion management team is game officials. Yes, they're there to enforce the rules of the game. They're there to make sure there's safe play in general based off the rules. But it's really important to loop your game officials in. So this could be a touch point before the game. Just go over whether you're a coach, athletic director, athletic trainer, designated school personnel, go over, meet the game officials. They're usually really nice people, and say, this is what I do. This is my role. We want to reinforce that it's okay for you to let us know that I saw something happen. I saw a kid take a direct blow to the head. They got up and kind of looked a little weird. I saw them going back to the huddle and they kind of stumbled. Encourage them to notify the sideline of that event. And also encourage them to actually stop play so that that kid can get appropriate follow-up. Game officials historically do not go through formal educational training for concussions. So you can reach out to your associations and to your local networks and say, hey, we'd like to invite game officials to our parent or team meetings based off of when we're going over concussions. You want to reach out and provide resources to them of here's where you can get additional training. And then also before the games, just do a brief rundown. Hey, these are the signs and symptoms associated with concussion, and this is my expectation of you during the game. All right, the athletic trainer. The athletic trainer in most schools is going to serve as your primary healthcare contact. Some of you have the privilege of having an athletic trainer. Some of you have the privilege of having an athletic trainer there all day. And in some situations, the athletic trainer is only there at the very end of the school day or after the school day. Based off your protocol, you may have a protocol that's separate between the school day and athletics. If you have an athletic trainer there during the school day, the roles of the nurse, of the athletic trainer need to be designated on who is going to see that potential concussion that occurred during the day or was unreported the previous day, but now they're exhibiting symptoms. Both are qualified healthcare professionals. It's probably going to come down to a frank conversation between the two of what's the best thing for us to do to handle this during the school day, or things that occur in PE. So during sports, your primary contact is almost always the athletic trainer. Based off the other roles that I've mentioned, the athletic trainer is usually the one that is, those other people will let them know about the kid being injured, but those are also the people that the athletic trainer is going to initiate communication with. So the athletic trainer is going to perform the assessment and make a medical determination, and then they're going to kick off the communication chain of, these are all the people that need to be informed per the protocol and for this individual person. Athletic trainer is also going to typically manage the return to play. So they're going to administer the MISHA return to play protocol. And they are going to qualitatively and quantitatively assess that individual as they go through the return to play. And they are going to make a medical determination in conjunction with other healthcare members for the readiness of that individual to progress. The athletic trainer is also commonly going to be one of the individuals leading many of the educational components to the other team members. A lot of times the athletic trainer is going to be the one that's developing the protocol. But the protocol development should be implemented in all schools and can be kicked off by anyone. All right, team physicians. Team physicians are going to be the highest ranked people from a medical practice standpoint, potentially on sidelines. The team physician is typically going to do, if they're available, the medical assessment for concussion. And then their main job is to communicate to the patient and the family. The team physician's role should be to then communicate through the athletic trainer, or per the protocol, it could be the athletic director, to kick off that communication, because they're usually removed from the actual school personnel. And so we want to pass that on to people already in the chain on the protocol. The team physician is also going to provide referral recommendations or follow up in their office. Okay, school nurse. School nurses. Oh, that's you.
Our expertise changes here. It's okay. You were on a roll. I think this, oh yeah, it's on. Okay, so the role of the school nurse. First of all, we have to remember that, research shows us that 40% of all concussions are in the non-athlete. So many of those happen during the school day or on their way to school or the night before, and then they land in the school nurse's office. The athletic trainer is not in the elementary school or the middle school. Typically, they're at the high school. So I have incredible respect for athletic trainers, just, like here. But they're not available in most schools, because when you think, usually a school district has maybe 1-2 high schools, and how many elementaries do they have, right? So the role of school nurse is very important. One of the tools that the school nurse uses, and this has been around for quite some time, is the CDC's concussion signs and symptoms checklist. And has anybody not seen this? Okay. So, this is just a really great tool. Obviously, you want to take a set of vitals on that kid that comes in. You want to find out, do a history of where and how the injury occurred, the force of the hit or blow. And then you also want to see if there were any witnesses, if there was any loss of consciousness, for how long, any memory loss. Typically, we see these kids come in from PE, and, you can ask them, just like the athletic trainers they don't ask who's the president. They say, what team are you playing right now? They know that, right? Or which team is winning? They know that, right? Okay. So we have to ask them appropriate questions too. So in addition to that, we do observe for signs, are they dazed? Are they confused about events? Are they repeating the questions because it's just, like a processing thing, and that kid does not have a processing disorder, can't recall events prior or after to the blow, loss of consciousness, even brief, shows behavior, personality changes, forgets class schedule or assignments. Well, your kids, some of them just never do know that. So physical symptoms, the usual headache, nausea, balance problems, fatigue, blurriness, sensitivity to light, sensitivity to noise, numbness and tingling. Now, when these kids come to us, we're assessing for so much more than concussion, because this could be, a multitude of reasons, depending on if they have a chronic health condition or whatever. We tend to see all of those kids. Many of those kids are not athletes. So, we have to think of a whole array of different things. Cognitive symptoms. Are they having difficulty thinking clearly or concentrating, remembering, feeling slow or slower than usual, feeling sluggish, hazy, foggy, groggy? Emotional symptoms, we talked about that earlier. Are they like irritable, sad, nervous, and, something out of the ordinary? One of the things we always look for is on the back. Typically, we'll do an initial assessment on the kid, 15 minutes, do another assessment on them, and, possibly 30 minutes later, doing another assessment on them. If everything's good, the disposition is you send them back to class, but you let them know, and you always give who a call, the parent or guardian, right? Because concussion symptoms can evolve, all right? And what you're seeing now might not be what you see after school or whatever. So the parents really need to know. Danger signs, those are listed on the back. If you have any of these, obviously you're going to call 911. A pupil larger than the other, unless it's a kid that that has one pupil larger than the other, because occasionally we run into that. And that's something typically that we pass all the way up the chain as they go from elementary to middle to high school. It's like, this kid's left pupil is a little larger than their right pupil. You need to know that. Drowsiness or can't be awakened, headache that gets worse or does not go away. Weakness, numbness, decreased coordination. These are all, red flags. It's like you get on there and call 911. Slurred speech, convulsions, seizures, difficulty recognizing people or places, and obviously you're taking another set of vitals to see what's going on. Unusual behavior, loss of consciousness. So, the dispositions are going to be either back to class, sent home to rest, with parents knowing, what to look for, and letting their physician know, or the students referred to the ER. And that can be either by parent or by ambulance. Oh, my pieces of paper. So, also communicate return to learn plan. After the diagnosis, the school nurse should discuss the student's return to learn needs. We talked a little bit about initial adjustments, and we talk to the parents too. It's really important that the parents are on board so they know what type of adjustments we're going to be making in school, and so that they're on board at home. Many times the parents of non-athletes have not gone through concussion training. I know you had a really great idea about the newsletter and putting information in there. Somebody said they'd utilize their webpage. There's always ways to get this information out to parents. So please do. And then when appropriate, get that consent from the parents so that we can discuss the child's care as the concussion progresses with the physician. Obviously, you can speak to the trainer. You're within the school, so we were covered under FERPA for that. This communication should be early, frequent, and ongoing as the student progresses through recovery. And then manage in school return to learn. Typically your athletic trainer is going to be doing the return to play. But again, you don't have an athletic trainer in the elementary or the middle schools typically. So this will actually fall on you again. So you have to make sure that, your PE teachers are trained. And there's great training through Misha. There's also training for PE and coaches on the CDC website. So, that can be done and you get a little certificate when you're done. So that's kind of nice. And then obviously you can have really good communication with your PE teachers. So the return to learn plan should be based on the current symptoms experienced by the student. You can utilize the Get School on Concussions, which is an excellent tool. And then since most concussions resolve in a week or two, a formal 504 is not usually needed, and academic adjustments will change as the student progresses. So, the adjustments that you make today might not be the adjustments that the kid needs 3 days from now or a week from now. So those will change. They're very fluid. And then if a 504 plan is needed, obviously the school nurse should be at the table to offer their expertise on that recovery. There it is. Okay. So role of the school counselor is a liaison with the parent in many cases. Nathan talked about the role of, the athletic director and trainer and team physician and all. But when we're talking, the little ones, the preschoolers, the elementary and the middle schoolers, for the most part, it works differently. And so there's no athletic director there. And so it falls on the school nurse and the counselor for the most part. And that's where you have to have that really great communication between the nurse and the counselor. So this is coordinated. Who's doing what? And it needs to be very consistent. So, the nurse's best friend in the lower grade should be the counselor's best friend, in the lower grade should be the school nurse. It's amazing what can happen if you two work together. So the school counselors liaison with the family, so far as, that communication after the kid's back, the initial symptoms are resolved enough to be back, and they can either be the contact person or the school nurse. It depends on how that works. Some schools don't have a school nurse, so it's going to fall on the school counselor. Some schools have both a school nurse and a counselor, and vice versa. So one contact person with the family is the most effective and efficient communication, and this may be the school nurse or the counselor, and all information between the school and family should be coordinated for consistent communication, just so key in the kid's recovery. And then champion the return to learn process. When return to school date's known, the school counselor can coordinate a return to learn plan with teachers, the school nurse, and other school personnel as needed. It's really important that they all stay on the same page as that kid progresses, so that we know what those symptoms are, if they're improving, if they're not improving, it would be the school nurse who would be making that communication. Okay, so this plan may include temporary academic adjustments based on, information from the healthcare team and current symptoms of the youth that the youth is experiencing. And those are things that you can put right into that Get Schooled on Concussion, and within 5 minutes, you get academic adjustments and plans that will help the teacher through the day with that child. And monitor and evaluate the recovery process, continue to communicate with the teachers, administrators, school nurse, and parents to determine changes in those academic adjustments. And then convene a 504 determination meeting if needed, and that's rarely needed. Okay. Some do, some don't. You hope that every school has all of the components that we've talked about today. Hopefully your school district has a school psychologist, and their role is really kind of a consultation role, where if there's prolonged or complicated concussion recovery situations, then they may do some testing and help with forming an IEP. And treatment, psychological counseling or other treatment may be helpful for the concussed youth. One of the things that Karen McAvoy talks about is that during the middle school and teen years, kids normally go through, periods in their life where they're not clinically diagnosed with anxiety or depression, but they'll go through bouts from here and there. And that happens with probably about a quarter of the kids that you see, and it resolves on its own. Sometimes it has to do with this situation. Sometimes it has to do with hormones. Sometimes it has to do with a boyfriend or girlfriend. You never know what that, but typically that will resolve. However, if they are having those bouts of, the little bouts of depression or anxiety, and you receive a head injury during that time, that can be really exacerbated. And so, the mental health concerns are something that we really want to watch, even the little ones all the way up. Okay, we'll see. Oh, we're back to teachers. Yay. Okay, so role of teachers, implement that academic adjustments or accommodations, depending on whether it's just initially or whether you have that 504. Support the student in the return to learn by adjusting learning timelines, student workload, and academic expectations. And then use that teacher assistant concussion tool TAC through Get Schooled on Concussion. We have the grant through, I believe, June. Maureen's still in here. But in the meantime, if it's June, thanks, Jennifer. It's really important that you get on there and just put in your profile, because that will allow you to download all those accommodation sheets and tip sheets. I mean, there are so many, and you just put them in a folder on your desktop. You never know when they're going to come in handy. Once you download them, you've got them. So hopefully we get that grant renewed again, but okay, establish return to full academic expectations based on the reduction of symptoms and recovery of the student, and estimated timeline of reducing and eliminating academic adjustments should be established by the teacher for their classes, because who sees that kid for an hour every day or more, right? The teacher. So the teacher's really at that point going to become that expert on how those accommodate or adjustments are working and what they need or not need. So it's real important that for that first couple of days back, maybe that first week, that somebody is the point person to check in with that student to find out what their symptoms are that day. And that can be the teacher, and that's fine. But that message should also get back to the point person, whether that's the school nurse or counselor, so that everybody can stay on the same page with the kid. Okay, next slide. Okay, role of administrators. To oversee concussion management plan, the administrators should be included in all communications with the athletic and academic personnel. I mean, who's in charge of the school? The administrators, right? So they need to be on board with all of this. When House Bill, 300 was passed back in 2011, every superintendent received a lot of information, along with the Missouri Athletic Association got all this information out to all the athletic directors, the athletic trainers, who, then subsequently got to all the coaches. And the school nurses got it through, training from the Brain Injury Association. And in the St. Louis area, we were fortunate to have Dr. Halstead, who trained a lot of us. So, but the academic team needs to oversee concussion management plans, at least be aware of it, and then be supportive of the interventions and enhance concussion knowledge. So that's one of their big roles, is to enhance concussion knowledge and be supportive of it. Every year there's a rollover of teachers, coaches. Some schools are lucky enough to keep the same staff for, 30 years. But I know that in my experience, there's always going to be a new coach or a new teacher or a new administrator or something. So this is why we do everything yearly. Okay. All right, the superintendent. Oh, yes, the superintendent has a role too. I remember this one, the law first passed. Ensure concussion management is part of the school safety program. Very important. The superintendent establishes expectations and directives to include concussion recognition and management within safety, school safety programs. And then allocate funding to enhance concussion prevention and management measures. So the superintendent needs to be on board with what the athletic department is doing and what the PE departments are doing, and the fact that their staff really needs this training. Role of school board members. I remember when this first passed and we had a representative from our school board at our district come to all the meetings and all the trainings so that he could take that information back to the rest of the school board members. And so their role in this, as we move forward forever and ever, is to provide funding for concussion management. The school board members must recognize the importance of concussion treatment and management and ensure adequate funding for concussion management programs within the school districts. And I think I'm supposed to switch back to physician and role specialty care providers.
Okay, so we've already talked about the sideline position. Now we'll talk about the more community health-based position. Their main job will be a point of access to provide a medical diagnosis. So they'll perform standardized assessments. They'll create treatment plans, make additional referrals if necessary, and they will communicate this diagnosis many times directly to the school, to the parents, to the patient, and sometimes the athletic trainer. It's important to note that a emergency department physician or an urgent care physician, and when I'm and this would also include physician assistants in that setting, or nurse practitioners, advanced nurse practitioners in that setting. They can diagnose a concussion with follow-up, but they cannot clear an athlete to return to play. So that return to play decision and sign off from a physician level or advanced practitioner level needs to come from someone outside of those two settings. They will continue to provide care and monitor care, and they will refer for advanced care. So these would be people with more like concussion syndrome type things, or someone who's identified with a very specific neurological component that needs to be addressed, migraine type things, anxiety, depression. Additional members of this team will be physical therapists. Physical therapists typically will step in and handle vestibular issues, vestibular ocular issues, so issues with balance, issues with staying upright, being coordinated, coordination between the eyes and movement. So very much dual task type things. So not just doing a balance or not just walking. This would be when you're asked to do something else in addition to that task. Physical therapists will commonly be the people that work with those patients. After concussion, especially more longer term based concussion, we will have patients with significant fatigue. They will get tired very easily, especially with physical activity. And the physical therapist is another member that can help increase the endurance of that individual and make it more safe for them to return and decrease the risk of injury. Occupational therapist can overlap with the services that I previously mentioned come from a physical therapist, but typically they're going to focus more on some of the return to learning type issues. They'll work on more dual task stuff in the classroom. They'll work on concentration. They'll work on the area of the brain that is now less efficient based off of concussion. So occupational therapists are a very important part of the kind of more school community team of getting back to return to learning. They do cross over into the physical world, but usually the physical therapist will take care of the more physical symptoms. Occupational therapists will take care of more of the learning mental type issues. For our patients that have long-term visual symptoms, these people commonly refer to a neurooptometrist. They're going to evaluate the nerves of the eyes, the actual eye itself, and they'll be the ones that manage that and make recommendations to the school regarding that condition. A neuropsychologist will do psychological evaluations on the athletes or the patient, and they will commonly deal with issues associated with anxiety, depression, poor sleep hygiene, anger issues, things like that. So they are commonly utilized in those patients exhibiting those types of symptoms. And then the mental health counselor will, sorry, a lot of things I just said about the neuropsychologist is the mental health counselor. But they commonly do work with neuropsychologists, and they'll be working along the same lines. Okay, I believe that's it. Any questions about anything we discussed?
Sure. Why not?
All right, Kitty.
So we're fortunate, we're in a metropolitan area where these specialists are around. Would you suggest that for people who are involved in care of somebody who might need that specialty, would you go through the physician provider, or would you talk to the parents or guardians of these students to say perhaps you should contact a person in this specialty?
I would definitely go through the parents.
Repeat the question.
So the question was basically if a student with concussion had symptoms that required or would benefit from PT or OT, would I go through the physician or would I go through the parent? I think it's really important that you have that good relationship with the parent. You don't want to bypass them. To have conversations with the physician is fine if you have permission, but the parent needs to be in that loop. It's very important for parents to feel like they have say and control over what's going on with their kids, because concussions can be very scary. So I would try having those conversations with the parent first. And, hopefully I have that little sheet signed saying that I can speak to the physician also. Or ask the parent, would you like me to speak to your physician for you because your son or your daughter is having these symptoms? This is going on pretty long now. I'm starting to get a little bit worried. And it all depends on the parent. I mean, parents come in all levels. I mean, we have parents that are emergency room physicians, and we have parents that are illiterate. So depending on, what the background of that parent is and their health literacy, the relationship that you have with them, I would try to go through the parent though, if possible.
I will echo and add to what Lynn said, which is, in my experience, parents like to be as educated as possible and they like to have options. And so I like to talk to the parents, hopefully be able to communicate their kids' concerns to them clearly, but also identify their specific concerns and then provide them options for them to discuss with their physician when they follow up with them. Any other questions? Kitty, you got another one?
Thank you for presenting. And from the Brain Injury Association of Missouri, we have a small token of our appreciation here. Linda, for you. Thank you.